That is 5-star topic. This Granulomatosis syndrome, the number 1 is GPA. Very typical syndrome of GPA. So Central Prime Minister. So see the rules. Hello my dear. So one of the most important topic, that is 5-star topic for exam, that is Wegener's Granulomatosis. The new name of Wegener's Granulomatosis, that is Granulomatosis Polyangiitis. The word itself, that the Wegener's Granulomatosis, is said the Granulomatosis Polyangiitis. Granulomatous disease, so they will produce a granuloma. So Granulomatosis Polyangiitis means granulomatous vasculitis. Already we discussed about the vasculitis. So this is a variety of small vessel ANCA positive vasculitis. So ANCA positive vasculitis, we have the C-ANCA and P-ANCA. C-ANCA vasculitis having a granulomatous polyangiitis. Wegener's Granulomatosis is a single disease that we must remember. P-ANCA, yes, once again, that is the microscopic polyangiitis. Another disease, Shastra syndrome, and sometimes P-ANCA, PAN can be positive. So these are the ANCA positive vasculitis that we need to discuss. So whenever we arise the topic like the Wegener's Granulomatosis, we must think about the ANCA positive small vessel vasculitis. Yes, this is the C-ANCA positive small vessel vasculitis. So let's see what is written in your notes, then we will discuss more so that we can be very expert on Wegener's Granulomatosis. Wegener's Granulomatosis is an autoimmune condition associated with the necrotizing granulomatous vasculitis affecting both the upper and lower respiratory tract as well as the kidneys. Features are the upper respiratory tract like the epistaxis, sinusitis, and nasal crusting. Lower respiratory tract involvement includes the dyspnea and hemoptysis. Rapidly progressive glomerulonephritis, that is possible in 80% of the patients, saddle-shaped nose deformity, and vasculitic rash, eye involvement, that is sometimes a proptosis, and cranial nerve involvements. Investigation C-ANCA in more than 90%. Sometimes a P-ANCA can be positive. Chest X-ray, wide variety of presentation including the cavitating lung lesions. Wegener's Granulomatosis granuloma will produce cavitating lung lesions. Renal biopsy. Once again, epithelial crescents in the Bowman's capsule. Crescents in Bowman's capsule. So management, once again, the steroid cyclophosphamide is the treatment of choice and 90% response and plasma exchange and median survival 8 to 9 years. So my dear, before going to the Wegener's Granulomatosis, I'd like to discuss more that is very important, that we must know. There is the one important hot topic that we call Granulopulmonary syndrome. So that will be a very good discussion, that is Granulopulmonary syndrome. Whenever this renal and pulmonary means the kidney and pulmonary involvement altogether, then you should think about Granulopulmonary syndrome. So when these two organs is involved, there are a long list of differential diagnoses, but what do we think about? We'll think about number 1, Wegener's Granulomatosis. We said the Granulomatosis Polyangiitis, another name. Number 2, we will think about microscopic polyangiitis, and we will think about the third disease is the GPS, my dear. Granulomatosis polyangiitis, microscopic polyangiitis, and GPS for Goodpasture syndrome, that is we call anti-GBM antibody syndrome. So these 3 diseases at least we should think about. Other diseases like we can think about, that is IgA nephropathy, and number 5 we can PSG and we can write. These 2 diseases also having associations with the Granulopulmonary syndrome. But there are a long list of diseases also can be included in this syndrome. But my dear, this box, SS box that I am saying, that you must remember this Granulopulmonary syndrome, the number 1 is GPA. Forget it now, and you must remember GPA. Because we'll discuss these 4 and 5 in the chapter of nephrology very well, so that we can understand much more better. Yes, we'll discuss now Wegener's Granulomatosis. So the two important things already we discussed in vasculitis means C-ANCA positive vasculitis, small vessel vasculitis, that is Wegener's granulomatosis. One knowledge. And second knowledge already we gathered, that is these involved in the two organs. There is lungs and kidney, means the kidney and lungs, means renal pulmonary syndrome. Yes, let's see how we can think about. So renal pulmonary syndrome, if I say the renal and pulmonary. So renal pulmonary means the kidney is involved. Kidney involvement is RPGN, rapidly progressive glomerulonephritis, and pulmonary involvement, upper respiratory tract followed by lower respiratory tract involvement. So yes, upper respiratory tract followed by lower respiratory tract involvement. Upper respiratory, the most common vasculitis leading to epistaxis, along with lots of like otitis media, nasal crusting, lots of features, and lower respiratory tract, the lungs is involved, so the hemoptysis. So epistaxis and hemoptysis, very typical history. Yes, the diagnosis we can think there is the granulomatous polyangiitis, that is we call Wegener's granulomatosis. So we can think about this Wegener's granulomatosis by these way, that I said the rapidly progressive glomerulonephritis leading to acute renal failure. We will study in the chapter of nephrology regarding the RPGN. Another name of RPGN is crescentic, means crescent, crescentic glomerulonephritis. So crescent formation is a very significant and pathognomonic findings in histopathologically in the Bowman's capsule that the RPGN presentation as the acute renal failure. So my dear, listen very carefully what I am saying, that the epistaxis followed by hemoptysis and along with the acute renal failure, this syndrome is very typical. The first diagnosis you should think about the granulomatous polyangiitis. The second important DD, my dear, second important DD that is very close, that is MPA, GPA, MPA, microscopic polyangiitis. Very similar presentation. Yes, yes, yes. What I say, the microscopic polyangiitis is the similar way of presentation of RPGN, upper respiratory tract followed by lower respiratory tract, the similar presentation, granulomatous polyangiitis and microscopic polyangiitis. Next disease, third disease. Third means third, my dear. I always say the serials that you must remember. That is we call GPS, Goodpaster's syndrome. Goodpaster's syndrome is very typical, my dear. Yes, the rapidly progressive glomerulonephritis is a typical presentation. Plus minus, with or without the lung involvement, but if the lung involvement, they usually do have the lower respiratory tract involvement, but upper respiratory tract involvement will not be happen here. I hope that you understood. So GPS is a separate disease, Goodpaster's syndrome. Another name of the Goodpaster's syndrome is anti-GBM antibody syndrome. Means anti-glomerular basement membrane antibody syndrome. Yes, I said what I said. The renal pulmonary syndrome, this renal with rapidly progressive glomerulonephritis, pulmonary, upper respiratory tract followed by lower respiratory tract with the pulmonary involvement, very typical syndrome of GPA. I said it, yes, that is the granulomatous polyangiitis. In contrast, the similar, the microscopic polyangiitis, similar presentation, and in contrast, the GPS, that is the Goodpaster's syndrome, is the third disease that you must remember. The differentials in clinically, we can do the granulomatous, the word granulomatous. So upper respiratory tract, we can write here saddle nose. And this saddle nose will not be happen here. So this is absent, my dear. This is very much important. Saddle nose is absent in microscopic polyangiitis in contrast to granulomatous polyangiitis. Now the question, how to differentiate in between these three diseases? Yes, of course, as I said, the antibody test will be helpful. This is the test of granulomatous polyangiitis. As I said, this is C-ANCA positive. In contrast, this is MPA is the P-ANCA positive. And in contrast, GPS anti-GBM antibody positive. C-ANCA of another name, I said the C for central, C for classical. Central is the, yes, PR3, Prime Minister. We can remember anti-PR3, another name. So we must do. So central, Prime Minister. Periphery, P for periphery. So you can remember MPs, Member of Parliament are the periphery. So MPO, so anti-MPO's antibody. The similar name, the C-ANCA, another name of C-ANCA, another name of the P-ANCA, MPO. So you need to remember. So the word, the granulomatous, and this is microscopic polyangiitis. The biopsy findings, the word will give you the idea. This is granuloma. This is the another important. Granulomatous polyangiitis. This is granulomatous and this is non-granulomatous. That's it. So this is the important box, my dear. It will be helpful, and these three diseases will be set up in your exam. I hope that you enjoyed. So once again, renal pulmonary syndrome. Renal means RPGN, presenting as acute renal failure. Pulmonary in upper respiratory tract followed by lower respiratory tract is a typical presentation of granulomatous polyangiitis, Wegener's granulomatosis, confirmed by C-ANCA test, and biopsy findings of granulomatous. That's it. Similar presentation to MPA. The differentiating points only the saddle nose is absent in microscopic polyangiitis, and this is the P-ANCA positive, and this is non-granulomatous vasculitis. In contrast to the the GPS, granulomatous polyangiitis, GPS is the Goodpasture syndrome or anti-GBM antibody syndrome, which says is the nephrology, the kidney disease, and this kidney disease is present with the RPGN leading to acute renal failure. Not always having the features of pulmonary features. So plus minus pulmonary features. If the pulmonary features is present, this is only the lower respiratory tract involved. If the pulmonary hemorrhage is the presentation. That's it, my dear. So this is all about the three important diseases that will be really helpful. Next point, I'd like to make another SS box will be really, really helpful for the granulomatous polyangiitis. Just write it down the box, SS box, for the granulomatous polyangiitis or Wegener's granulomatosis. As already you have seen, this is nothing but we already know this is C-ANCA positive disease. So this C will be helpful to remember all these features, at least the C-ANCA positive, the thing we know about it, and C for once again, there is a cavitating lung lesions. The lungs will have the cavitating lung lesions. That is Wegener's granulomatosis, granuloma. Once again, this C will be helpful in kidneys. That is the crescents in capsule. Means in Bowman's capsule, we'll get the crescents, means the crescentic glomerulonephritis. That will be really helpful. And of course, the treatment, corticosteroid plus cyclophosphamide, corticosteroid plus cyclophosphamide, and of course phosphamide is plasma exchange, is a treatment of choice. Then we can remember all these things together, and that will be really helpful, the features of Wegener's granulomatosis. So make your box once again, C-ANCA positive. So C is the rule, C-ANCA positive, cavitating lung lesions, there is pulmonary involvement, and crescents is the renal involvement. So renopulmonary once again, we can remember. So yes, the treatment is the most important cornerstone. That's in your exam, it will come up. So C for corticosteroid, C for cyclophosphamide, and once again the plasma exchange from famide, so it will be helpful. So all these things together, I hope that you must remember. So once again, so GPA is nothing but the C-ANCA positive. So the rule of C, that is cavitating and quiescence. These two is the cornerstone, that is the renal-pulmonary syndrome. Renal-pulmonary syndrome. So yes, the treatment, this is the box. The middle box, the cavitating and quiescence. Just remember from this box. This box will be really helpful to remember all these features of Wegener's granulomatosis. I hope that you enjoyed, my dear. This will be really helpful with this Wegener's granulomatosis and very tiny, very delineation features of granulomatous polyangiitis, and then next is the microscopic polyangiitis, and next is the anti-GBM antibody syndrome. I hope that you enjoyed. Thank you very much. Thank you once again.